So, as a nurse, what are some things that you would recommend that people really understand about their oxygen prescription?
Very important question. So I think it's important that patients understand exactly how to use their oxygen, specifically how much to use at rest, and it could be zero. It could be your saturations are okay at rest. How much to use when you're exerting yourself, and how much to use, if any, with sleep. So those are three different prescriptions. So it's important to ask your clinicians how to use your oxygen with different settings. The other critical piece, I think, in terms of education is understanding the differences between the equipment settings. So if a prescription is written as liters per minute, the small portable oxygen concentrator, those settings aren't in liters per minute. Some of those include those, but rarely. Instead, these are settings, and it's on what we call pulse dose. So this is a very important understanding that patients need to have, is the difference between a pulse dose setting, a number setting on the POC, versus a liters per minute, because they may not be equal. So if the physician prescribes 4 liters per minute, and the portable oxygen concentrator is set at a setting of 4, the delivery of oxygen may not be equal, even though they're both on 4. So it's important, again, to just have that confirmation of looking at a pulse oximeter with whatever equipment that patient's using. And that's the bottom line. So if your POC is set at 4 and the saturations still don't go over 90, that's a time to call the clinician. So I think nurses play an important role in this education. Not all practices have a nurse available, but in terms of the patient importance of understanding their equipment, how to use it, and what these different flow and settings mean is really critical.